Good morning, folks. We'll get going in about 60 seconds. Okay, we'll go ahead and get started. Good morning. I am Dr. Joe Cantor. I am the CEO of ASTHO, the Association of State and Territorial Health Officials. I'm so delighted to welcome you to this Deskside media briefing on the upcoming respiratory virus season and important ways that state and territorial health departments are leading here and that folks can protect themselves. I do want to mention before we get started, I want to take a second, step back, and express on behalf of ASTHO and on behalf of health departments across this country our deepest solidarity with CDC staff and employees and the broader public health community in the aftermath of the horrific shooting on the CDC's campus last Friday. I will tell you this is a personal issue for me. I'll tell you that public health professionals across this country show up to work every day and they have one singular goal in mind, and that's to help improve the health and wellness of other people. We know that these are heated times, and we at ASTHO implore everyone to help dampen slander that is undeservingly aimed at public health professionals, and also to recognize that all public servants across all sectors embody a high degree of humanity and show up to work helping to make this country a better place. I also want to take a second and honor the life of the Cobb County police officer, David Rose. He lost his life in that shooting. I understand he left behind a wife, 2 children, and one on the way. We offer our deepest gratitude to his family, as there was no question that his sacrifice saved lives on Friday afternoon. With that, we are pleased to transition and speak about the upcoming respiratory virus season. Let me introduce Dr. Susan Kansagra, the Chief Medical Officer of ASTHO.
Great. Well, thank you so much, Dr. Cantor. Really appreciate those opening words and the solidarity that you expressed for public health workers around the country, and of course for our CDC colleagues, and of course Officer Rose and his family as well. Appreciate those opening comments. And yes, now we're here to talk about respiratory virus season. We know certainly there's a lot to think about this season as we embark into these coming months. And here with us today are 3 state health officials that are ready to share more about how they are thinking about this in their state, what they are doing to prepare in each of their states, and then answer your questions and hear what's on your mind and how we can best provide information back to you and to the public around this virus season coming up. So let me quickly introduce each of our 3 panelists, and then we will kick it off to each of them to start and share a few opening comments, and then we'll open it up for questions. So start thinking of those questions and please put them in the chat. That will help direct me to those questions and be able to appropriately make sure that we are sending them to the right person to answer. So please start thinking through those. Feel free to go ahead and put those in the chat as they start coming in. So first, I'd like to introduce Dr. Manisha Juthani. Dr. Juthani is the Commissioner of the Connecticut Department of Public Health. She's also President-elect of ASTHO. Thanks for being here, Dr. Juthani. Second, we have Dr. Bennett. Dr. Bennett is the Director of the District of Columbia Department of Public Health. We are pleased to have her here, and she will share more about how they're thinking about this in their jurisdiction. And then we have Dr. Scott Harris. Dr. Harris is the president of ASTHO. He is also the state health officer for the Alabama Department of Public Health. So we are excited to have each of them here to share more about what they are doing. And I will start off by turning it to Dr. Juthani to give us opening comments around how she is thinking about this in her state and how their teams are approaching preparations.
Thanks so much, Dr. Kansagra and Dr. Cantor, and thanks for the opportunity to be with all of you here today. So as we are starting to approach the start of the school year and entering the fall season, this is the time when we always reflect on how we can best protect our communities in the months ahead as we enter the fall and winter season. As I look back over the last 5 years, thinking back to 2020 when COVID first emerged and we were going into our first respiratory viral disease season. At that time, we started that season without a COVID vaccine. But in the years since then, we've had COVID vaccines. And for several years, COVID was the dominant strain in the winter season. What we saw last year is that flu reached levels that it hadn't reached in almost a decade. We had the most hospitalizations, we had more deaths, there was more burden of disease from flu last year over many of the last several years. And COVID has still had somewhat of a seasonal expression of disease, but it is different than it was in the last several years. So I give that background because I think whenever we enter a new respiratory viral disease season, we just don't really know what the dominant virus is going to be. And we have three that we have opportunities for protection around. One is flu, second is COVID, and the third is RSV in very specific populations. So as we're going into this season, what I like to remind people about is we don't know which is going to be the most severe, and the best advice is really to get vaccinated if you are eligible for the respective vaccine. And so particularly around flu and COVID, which are pretty much have been the recommendations for 6 months and older, we are still awaiting further recommendations from ACIP regarding COVID vaccines. But I do think that going forward, protecting yourself against the viruses that we have protection for. We know that every respiratory viral disease season, there are respiratory viruses that we do not have opportunities for protection for. So this is really a chance to reflect on that and take the opportunity to protect yourself. Here in Connecticut, we are very proud of the fact that we currently have the highest MMR vaccination rate for kindergartners that are entering kindergarten at 98.2%. And that has been very successful for us over the last several years, getting our immunization rates to even higher than they were pre-pandemic. And we are one of 9 states that don't yet have a measles case. So it is proof that having high vaccination rates certainly do help protect your community at large. We do have cases throughout the country. I will not be surprised if we do have a case in the weeks and months ahead, but at least up until now, those high vaccination rates are something that we can be proud of going into the school year, and just taking this opportunity to remind families and parents that this is the time to reflect on what your children's vaccination status is and try to get as protected as you can as you start the school year. Thank you. I'll turn it back to you, Dr. Kansagra.
Great. Thanks so much, Dr. Juthani, for some of those opening thoughts and comments. I see questions are starting to come in the chat. That's great. Keep them coming. We're going to get to those in just a second. But first, I'm going to turn it over to Dr. Bennett next to share some opening thoughts and comments around how they are thinking about this upcoming season.
Well, I also have been really fascinated by the last several years. COVID did have a big impact on how all of our viruses behave. We've seen some things look more severe than they used to, other things occur at a different time than they used to. Over the last few years, watching RSV, flu, and COVID line up with each other has been really concerning as we worry about the burden on our hospitals and how many people are there. But for the most part, I think partly as a pediatrician, but partly just because that's where I think some of our dangers are, am very concerned about just generally how we look at vaccines in our children. I know that we are having a national conversation about COVID vaccine and children, but really looking at RSV, flu, and COVID as all threats that are not things that children are safe from, that they need to be in the conversation about what we do on those things. We have hospitalizations of kids with flu. We have hospitalizations of kids with RSV and COVID every year, and we need to still be aware of them. In general, our thoughts around where kids and vaccines are going, there are little signs that the disinformation or some of the confusion that families are having has impacted how they vaccinate their kids, both for regular school-based vaccines and for these respiratory viruses. And that is a trend that we need to really be concerned about, because children have special vulnerabilities, and we want to be sure that if we have protection, we're delivering it to them. And you don't necessarily only have to do things to worry about diseases that we find to be especially dangerous in terms of fatality. I want kids to not miss 2 weeks of school. I want kids not to be hospitalized or in urgent care and miserable. We want them to be able to live their lives when there's no reason why they shouldn't, right? If I can prevent something, I should do it. And this is something where we absolutely have prevention available.
Great. Thank you so much for those words, Dr. Bennett, and also this idea of focusing on multiple endpoints and this idea of keeping kids in school is important, as well as ED visits, preventing hospitalizations, all those things. So thanks for those comments. And last, I will turn it over to Dr. Harris to give us his thoughts as we approach the season and what their state health department is doing to prepare as well.
Thank you, Dr. Kansagra. Thank you all for being here. We are thinking quite a bit about vaccine hesitancy, and I wanted to make just a few comments on that. Clearly, this is an issue that we have been dealing with in a very public way for quite some time. We know that nationally, the number of parents requesting exemptions from vaccines has increased, continued to increase. And in fact, last year, the vast majority of states saw increases. 37 or 38 states had increases in the amount of people seeking vaccine exemptions. That doesn't necessarily correlate exactly with hesitancy, but probably it does. And certainly we have a lot of evidence from what we've seen with the measles outbreak in the Southwest and other places of populations that are just unvaccinated and unfortunately at risk when it may not be necessary. We have been thinking about vaccine hesitancy since COVID, when it became really clear to us that the message that was going out was a lot less important than the messenger who was carrying the message. We'd like to think that we can educate the public and that they believe and trust what we are saying, but clearly that's those times are a little bit different now than we have seen in the past. It's a very common thing that we say in public health about population health programs, in that we want to use trusted messengers to serve as proxies for our message. But in Alabama, at least, that trusted messenger concept is less of a talking point and now more of an explicit strategy. And so what we have moved to do is to use our medical officers to interact directly with providers and provider organizations to try to make sure that they are available to answer the questions and the uncertainty that many families are facing or that many individuals are facing about vaccinations. I think anecdotally, we feel like a lot of the vaccine hesitancy we see, particularly in parents of young children, doesn't represent what we would really think of as an anti-vax mindset. It merely represents confusion in a lot of cases. There are people who getting information from many different areas, many of it conflicting. Many of the things they're hearing are in disagreement with each other. And so many times they just don't know where to get good information. So our messaging has been towards talking to your healthcare provider, and we have really concentrated on trying legislation in my own state to make it more difficult for us to do that as an agency. We've had legislation that would prevent us from doing any advertisement at all. We've had legislation that would make vaccine exemptions much more easily available, broadly available. We were successful in that neither of those particular things passed this current year, but we know that those things are coming back. And that just gives you a sense of where state legislators are, at least in a red state like the one in which I'm in. So we feel like the best way to overcome hesitancy is to have people have those individual conversations between their provider and themselves or about their children. We're doing our very best to try to educate those who are leading those conversations, not only giving them evidence about the science behind vaccination, but also reminding them the importance of being a good listener, taking people seriously, giving credibility to their fears and concerns, and hopefully helping them to make a good shared decision.
Great. Well, thank you so much, Dr. Harris, for outlining some of those considerations at a state level, some of those policy considerations and how you're communicating with the constituents of your state. So I see a lot of questions have come into the chat, so we can flip over to the Q&A portion of this. And again, keep them coming as you think of them. I'm going to start to go down the list and direct these to our panelists. And certainly feel free to chime in, panelists, if you see others answering and you want to chime in on this as well. So first, I'll start off with a question from Jessica from Inside Health Policy. She's asking for a comment on how potential changes to FDA approval around COVID shots for those 5 and under is impacting health departments and some of the downstream implications for that. I know certainly we've heard potentially that, at least one of the manufacturers might not have an EUA approved for this age range. So Dr. Juthani, I'm going to direct this one to you. Can you talk a little bit more about that and how that impacts state health department preparations?
Yes, thank you, Dr. Kansagra. So as you mentioned, our understanding is that the EUA for the Pfizer shot in that age group has not been reapproved. And so that may not be something that's available in this season. So our understanding is that the Moderna company is looking at trying to make sure that they can fill the gaps and make it more available to those pediatricians who would be able to administer that vaccine. And so what we do as a health department through the Vaccines for Children program and through the Connecticut vaccine program. So the combination of those two, Vaccines for Children being the federal program, Connecticut vaccine program being the local program in Connecticut, the combination of the two provides vaccine coverage for all children in Connecticut, is that we look at what's available and then we try to order and work with our providers to make sure that they know what's available to be able to help protect the kids in their community. So we are looking at these changes and these movements and trying to fill the space and work with our providers so that those gaps can be filled, and try to work with providers that have primarily used Pfizer up until now to be able to get them ready and prepared to potentially use the Moderna shot. And the Moderna shot does look like it will be available. So that is our hope, that we'll be able to fill the gaps with that.
Great. Thanks so much, Dr. Juthani, for sharing your thoughts on that. Let me turn it over to you, Dr. Bennett, to see if you have additional thoughts you'd like to share on this as well.
I will just say that because there have been so many years of these systems being integrated, of the ACIP recommendations and our purchasing through Vaccines for Children, that if there are changes in that system, it is hard to determine where the impact will be. So it is not a straightforward question. What we're doing is looking at where do we have the ACIP recommendations in our legislation? Where do we have those recommendations in other places? What would that mean for our school recommendations? And we really do have to spend some time trying to untangle what is really decades of a system that we really didn't have to think about. I do think it'll take us a little while to be sure of that. The other is that much of what's going to happen is going to be mediated through insurance. So there's a limited amount that we as health departments will be able to do. Even our own purchasing of vaccine, we do some, but really the vast majority of people are going to get their vaccine mediated through insurance coverage. And so we've been talking to our colleagues over in the state insurance area to look at what that means for them. How are they planning on it? For the most part, health systems and insurance would all love for people to be vaccinated, because the burden on our health system and the burden financially for them when people get flu instead of a flu vaccine, it very much is weighted on the side of vaccine being the better choice. But they are still having to really think through what that means for them, what options they have. This is all happening very rapidly in a system that's been stable for a very long time. So any of the questions about what we're going to do are mediated by the fact that we're still having to figure out how the system is integrated together, because it's worked seamlessly for a very long time, and we haven't had to pull apart the pieces before.
Thanks, Dr. Bennett. Oh, go ahead, Dr.
Sorry,
Juthani.
if I could just add one other comment on that, which is that one of the challenges here is that this really varies state by state. And so as a person living in a given state or jurisdiction, it really depends on the situation in your state. And that may be one of the themes we hear today, is that, every state is trying to figure out all of these challenges. I can just say in Connecticut, and this is only for children, but there is an insurance fund that the insurance companies contribute to that allows for us to purchase all the vaccines for all children in the state. And that's why the only thing that insurance companies get charged for when a child is vaccinated in Connecticut is the administration of that shot. The shot is purchased through agreements that we have. So again, whether it's going to be purely insurance dependent or otherwise, it really is going to depend on where you live. And so as somebody living in a given area, you really need to understand what's going on in your local community.
Thanks, Dr. Juthani. Appreciate that. I want to go to the next question in the chat, and I feel like actually we have already touched on this a little bit in hearing both of your responses, but an opportunity to go a little bit deeper in talking about the ordering of COVID and flu vaccines, how changes to federal recommendations might impact the ordering of those vaccines, the ability to carry out immunization drives, and what some of the unknowns around future ACIP votes might mean for how you're trying to plan some of these logistical things on the ground. So let me turn it first to you, Dr. Harris, on that one, if you've got additional thoughts on how you might be preparing given some of those unknowns into the future.
Yeah, thank you. I mean, at this point, we have continued to make these same recommendations that we have made in the past. We've not changed our guidance right now. Ultimately, as I mentioned in the first time I spoke, we are encouraging people to have individual discussions with their clinician. That clinician may be a public health nurse who works for us, but it might be someone they see in the private sector. But we've not changed our recommendations on that, and we're committed to still trying to provide vaccination services for anyone regardless of income. For low-income people, those are going to be, heavily subsidized on our part. We don't have unlimited resources to do that, but we have identified resources that will allow us, we think, to meet the demand that we typically face. In many cases, we're now, of course, trying to build insurances for when that coverage is available. Not something we have always done in the past, and with all the attendant, bureaucratic processes that go into that. Many of our counties, we have individual county health departments that provide services, 67 in our state. Many times we are limited to a county fee bill determined by a county commission that might allow us to recoup $2 or $3 or $4 for a vaccination, and really nothing else at all. So it's not, we certainly don't have unlimited ability to continue doing those things, but we are committed to doing those as long as we can.
Great. Thanks, Dr. Harris. I want to go to a question, and I know some of these, we're answering because a lot of these questions are overlapping, but Karen has put in the chat a question around what will determine coverage by both private and public insurance of these vaccines for individuals nationwide. Dr. Bennett, you talked a little bit about insurance coverage. I wonder if you might want to chime in on that specific question there.
Again, it's going to be one of those things that's going to vary for people depending on what state they live in. There are some state-based rules about what has to be covered. There are rules within the ACA about what has to be covered on those plans, particularly for plans through the exchange versus others. So it's going to vary. What is changing is what insurance companies are allowed to do. So they may in fact choose to simply cover some of these things under their plans, but things that were automatic may in fact now be more variable as people make those business decisions on their own. I would say to families, this is the season we want you to start getting these vaccinations anyway. And so if you are looking at getting especially the respiratory viruses and the school vaccines as we're coming into the school year, this is the time to really start finding out this information. Lots of things haven't changed quite yet, and it might be worthwhile, since this is the season we want you to get it anyway, to try to get those things in the right time, which is the early fall, rather than wait longer. I will say I do think the uncertainty increases the longer you wait, but you should get them based on the recommendations. Right now, we have not changed ours. There is a lot of work being done around different groups making different recommendations. It does increase, I think, the confusion for some people, but having established groups like the American Academy of Pediatrics or the American College of Obstetrics and Gynecology make very firm recommendations that keep us essentially not changed from where we have been, I think should reassure families that they can continue to do what they have been doing, which is go to their doctor, look at what's been recommended for them by their physician, and then get those things. Now is the time to really start thinking about it so that you can plan, make your appointments, and act in the early fall, which is when we want you to get your vaccines.
Great, thanks, Dr. Bennett. And Karen, I see you put in a clarification at the end, and I think actually Dr. Bennett answered that in some ways around other groups that insurance companies might also be looking to. You know, as we know, ACIP represents a floor for insurance coverage, and certainly insurers can look to other places. AAP is one of those as well that Dr. Bennett already mentioned, you know, for additional data or supports. And so how insurance companies make those decisions, you know, can vary from company to company, and they might look at different resources. So thanks for that. I'm going to flip now to a question from Ariel from CQ Roll Call. And that question is around how state and local health departments had communication with the new CDC director, Dr. Monterez, and what do you hope to see from the new director? You know, I'll just start off with one response to that on behalf of ASTHO. We routinely have CDC directors come on our calls with state health officials. We have been in touch with Dr. Monterez's office. They reached out very quickly after her confirmation to make sure we could have and start those discussions and get her on the schedule to speak with our state health officials. So we have been in touch and are setting that meeting up. But let me just turn it over to our three state health panelists to just talk about if there's any other opportunities they see, especially with the CDC director here, and what they hope to see in the future.
Yeah, I would say I've not personally met Dr. Monterez, but I'm certainly aware that ASTHO is arranging for her to communicate with our state health officials as the CDC director traditionally does. Very excited to see how this will go. I think it's a little bit different to have a non-physician in this role. Certainly not unprecedented, though. She's clearly a longtime public servant at CDC, and like any new person, has a lot to learn, I'm sure. Obviously, the schedule of trying to arrange these has changed significantly since last Friday's events, but we do look forward to meeting with her as soon as possible.
Great, thank you, Dr. Harris. Let me keep going down the chat because I see lots of questions rolling in. So next from Meg from the Denver Post, would you recommend that parents of young children take them for the COVID vaccine now, given the uncertainty about what may come out of ACIP? So thoughts on that or suggestions for parents around what they should be thinking about for their children as it pertains specifically to COVID vaccine?
I'll reiterate, the before respiratory season starts is when we want you to start thinking about your protections for respiratory season. And we think of that as the late fall into the winter. So, you know, it's mid-August, school's going to start, kids are going to start congregating together. It's going to get colder. This is the time right now to be starting to make your appointment. Most people that requires a few weeks or at least a little bit of lead time. So yes, I would, but not necessarily because things are changing, because this is the time of year we're normally telling you to go figure out where you're going to get your flu shot, where you're going to get your COVID shot, and all of those standard things. I want people to do that standard routine right on time, which is about now.
Great, thanks, Dr. Bennett. Anything else you'd like to add on that question, Dr. Juthani or Dr. Harris? No, okay, great. So then moving on, I see a question from Nada at State Line. How are state health officials developing their own vaccine guidance around vaccines, particularly around pregnant patients and children, you know, given the HHS recommendation? So thoughts on this and how states are navigating?
I'll start with a few thoughts. So I think that here in Connecticut, we've not changed any recommendations so far. We continue to recommend COVID vaccines for children who always have shared decision-making as it relates to any vaccine that a child receives. It's part of a decision of a parent in making decisions for children. And for pregnant persons, they also fall in the category of special populations. And so we continue to recommend vaccinations, COVID vaccinations for pregnant women as well. As we look forward, we know that many states are evaluating how they may look to making recommendations going into this fall. So certainly ACIP is one source of information, but as has already been discussed, there are a number of the professional societies that have also said that they will be putting forward recommendations going into this fall. And actually, if you look at historically the recommendations for children, it actually used to be the American Academy of Pediatrics before ACIP took it over, if you look back decades and decades ago. And so that is not unusual in many ways for AAP to weigh in on children's vaccinations. So I think that we will have a number of professional societies that are also making recommendations. And then each state is looking at their own laws, what in fact is the statutory framework upon which recommendations around vaccinations are made for children, for adults, for pregnant persons, for immunocompromised persons, and the like. And then based on that, also determining whether they need to make any changes or whether they would like to potentially put together an advisory group of their own. And so every state is different, and those are the types of things that are being evaluated right now. I think in addition, I can just say in Connecticut, we have received some word, at least from our insurance providers, that they have not changed any coverage as it relates to vaccinations up until now. That will be something we continue to work on with our insurance department here in Connecticut to get a sense of what the private insurers, and then of course we have the federal and state between Medicare, Medicaid, looking at that full framework of different insurance providers in the state. But as of now, there are no changes here in Connecticut, and every state may be different on that, but I can speak to that here. So that's what I would say in terms of how we're looking at things going forward right now.
Thanks, Dr. Juthani, for outlining some of those nuances and how you're thinking about it at the state level. Dr. Bennett, let me turn it to you to see if you have additional thoughts on this as well.
I actually wanted to clarify for the writer from the Times that I did not mean go get your flu vaccine now. You will get last year's if there even is one. What I meant to say is this is the time to start planning when you'll do that, to start looking at what if you have a question about your insurance coverage, because early fall is when we want you to get them. So if usually right around the end of September or sometime around there. And for most people, if you're going to try to discuss whether you're getting it or not, and when you're going to get it, now is the time to start figuring out when you're going to get your appointment with your doctor. You're getting your school shots anyway. So I don't mean that you should go get your vaccine tomorrow. There probably isn't anywhere where you could do that. But if you are worried about what you should be doing, now's the time to start to pay attention, which is why we start to do these things now, because it does take people time to actually get from the time they start to think about a thing to where they get a shot in arm.
Great. Thanks for clarifying, Dr. Bennett. Appreciate that. Going on to the next question from Celine, and I know this touches a little bit on some of the responses you've already heard from Dr. Juthani, just around how state health departments are considering their own vaccine recommendations, whether those might be different from ACIP if they are coming up with their own recommendations, particularly around children or other high-risk populations. So let me just open it back up. I know, Dr. Juthani, you've already commented on this. Feel free to add on, and certainly Dr. Harris or Dr. Bennett, if you have additional thoughts to add, would welcome your thoughts on this as well.
Yeah, I would say there's still some uncertainty about that. As Dr. Bennett alluded to earlier, there are some states that actually have statutory requirements related to the adoption of ACIP recommendations, and a few states like that. Not most, I don't believe. In my state, for example, we have an overseeing board of medical professionals at our state board of health that actually makes these recommendations for our state. They typically parallel ACIP, but not in all cases. There've certainly been vaccines in the past where they've not been in complete agreement. So I would say it's a state by state difference. It'll be a little bit different from place to place. And obviously, it really does matter what kind of recommendations that we see from ACIP. We certainly want to see the scientific rationale behind what recommendations are made. We want the ability to evaluate those ourselves as well. And I think it's just going to take some time to know the answer for sure.
Thanks, Dr. Harris. I see a question from Mike around, have any state health departments changed their vaccine recommendations in the wake of changes from ACIP or HHS in the last few months? Dr. Juthani, I wonder if you might want to start off on this one.
I'm not aware of any states that have made changes, but I can speak to Connecticut, which is that we have not made any changes. However, we do know that the thimerosal containing flu vaccine is no longer going to be available. That was a very small fraction of vaccinations that were offered nationwide, and certainly in Connecticut itself, with roughly 2% of vaccinations being thimerosal containing. So I do not anticipate that to be a major impact for us. Those were those multi-dose vials in settings where maybe there were multiple people that are going to be vaccinated one after the next. Certainly will be an inconvenience for people where they were hoping to be able to have multi-dose vials and will need to have individual shots. It potentially could be more expensive. I am not really sure on that, but that is the only impact we are seeing up until now going into this season. Other than that, I'm unaware of any states that have made specific changes, but there could be that I'm unaware of.
Thanks, Dr. Juthani. I think we've caught up on a lot of the questions. Let me just open it up, Dr. Harris, Dr. Bennett, Dr. Juthani, for all three of you. If there's any, while folks, we give another minute or two to see if folks have questions, any other, overarching thoughts as we head into the season and how you're communicating with your communities, in this time of lots of information out there, lots of misinformation out there, how you're working to ensure that folks are getting the right information that they need to make the right decisions for their family.
I would just, once again, say that we're really working hard to communicate to the public when we have that opportunity. Please talk to your healthcare provider, talk to the person that knows you and your family can help you make those decisions. We don't think that we necessarily have the same authoritative voice that we might have had a decade ago in trying to guide people in what to do. But we do believe that people trust their healthcare providers in most cases and are certainly willing to listen to them.
Thanks, Dr. Harris.
I
Dr.
would,
Ben or Juthani, go ahead.
sorry, yeah. I would just add that I completely agree with Dr. Harris that your provider is somebody who you have a relationship with, knows your child, knows you, and can certainly advise you. I think one of the things that we're working on as well is to continue to have the Connecticut Department of Public Health be a trusted source of information for people in the community. And we work hard every day to gain that trust, to meet people where they're at, so that people can have some confidence when they have questions that we can answer them, and that we can be a source of information in a place of a lot of confusion at times, and trying to figure out where to find information that can help you make those best decisions for your family. I think that the United States of America has been a beacon of scientific discovery and expertise for generations. And I look forward to seeing that we continue being that, coming up with innovative ways to help care for people, whether it's regarding infectious diseases or other ailments. And going into this season, we're looking at that as well, and just looking at trying to leverage the best opportunities, the best ways that we have that can care for people in the state and help prevent infection rather than having to suffer through infection. And as we look at respiratory viral disease season, we know that these vaccines are very, very protective as it relates to morbidity and mortality from disease. They may not prevent every single disease, but the reality is people get back to work faster, people transmit infection less, and those are very, very important outcomes. They get back to school if their children faster. They are not taking time out of sports, activities, other engagement in social life that so many were set aside during the pandemic. And as people are engaging in life fully, we want people to be able to continue doing that. So really taking this moment to think about how to protect you and your family best is where we try as a health department to help people see us also as another trusted source of information for the community.
Great. Thank you so much, Dr. Juthani, for highlighting that. Let me just see, Dr. Bennett, if you have any thoughts on that. I know, actually, I see a few more questions perhaps coming in, but in the meantime, if you want to round out this question around how we communicate and how we ensure that folks out in our communities are getting the information they need.
I will highlight that as public health departments, we always have the concern for what you as an individual are able to choose to do. And we want you to have the freedom to choose that, but also the access to be able to pick the choice that tells you what kind of winter you want to have. But we also have to think about the whole system and the whole community. And that means that being aware that there are communities that have less access and how do we get it to them. There are communities that have higher burden because of illness or age that we need to think about, and that there are health systems that have to manage this strain when we do have a bad season that we can't predict. So we have to be ready for. So we need everybody to really be thoughtful about what their choice is. And then we will take that information about how vaccinated our populations are and how much information people were able to get, and then try to work with the season that we end up with. But we can't always predict that. So we're going to have to, all of us, do our best to protect ourselves and protect our health systems and our communities. And we will do everything we possibly can. But there is always an element of unpredictability that we don't control. And so we will have to wait and see. And we're going to do everything we can to be prepared and hope for the best. But the degree to which people participate will determine how the season turns out.
Thanks, Dr. Bennett, for those thoughts as well. Let me ask one last question that I see coming up on the chat, which is around your concerns around or thoughts around how the federal recommendations will affect children and adults in communities of color who may disproportionately suffer cases or have lower vaccination rates that we saw during the pandemic. And so how you think the future may play out for these communities, and thoughts on that.
Well, I think we did a lot to shore up access during the pandemic that most of us used COVID era funds to do that we don't have anymore. So I expect we may lose some ground in terms of vaccination rates for folks who would love to get vaccinated, but had a lot of problems with transportation or funding or other reasons why they weren't able to. That is something I'm very concerned about as those funds are no longer available. So we will see what happens, but we're doing the best we can with the resources we have. But I want people to recognize that there are fewer resources than there were before. And most of those resources went to trying to bring in the folks who maybe weren't having equal access or equal opportunity and bring them in so that they could be as protected as everyone else. And if we are unable to do that, we are going to see more infections in those communities, and unfortunately, more outcomes of those infections.
Thanks, Dr. Bennett, for highlighting that, and especially some of the challenges with the contraction of funding as well. Dr. Juthani, let me see if you have additional thoughts on that, and then Dr. Harris, I'll give you the last word.
My only other additional comment was that in usual times, there always is a reliance on partners like federally qualified health centers. And that is a place where people will often go to be able to get vaccinations and other healthcare. During the pandemic, there was an influx of funding to be able to have health departments have additional resources on the ground, whether it be home visits, whether it be vaccine vans, whether it be mass vaccination clinics. Those were all additionally funded interventions that we did in the context of a pandemic and in the context of getting an influx of funding to be able to have those kinds of interventions. So we are now back to usual times where we have to rely on the usual places where people can get healthcare. And we are reliant on those partners, and we work with them to be able to try to provide that access. But the reality is that there's only a certain amount of bandwidth that everybody has with the funding that they have. And so we all are just trying to do the best we can and do more with less if that's what it calls for. And we'll continue to try to do that.
Thanks, Dr. Juthani. Dr. Harris,
Yeah,
closing thoughts from you?
I would just echo what Dr. Juthani said. I'm not sure I could say that any better. We are, we're safety net providers, certainly when it comes to the provision of clinical care. At least we typically take care of people who don't have a lot of other resources. In my state, that typically means people of color. It's low-income individuals. The funding that we get to help us subsidize these services is really important. I'm extremely concerned about what will happen as we see resources going different ways. When you stop subsidizing something, you're going to get less of it. In our case, we're going to be less able to provide care to people who really don't have a lot of other options, unfortunately.
Thanks, Dr. Harris. Well, I see we don't have any other questions in the chat, so I wanted to just round out and say thank you to all three of our state health officials for sharing what is happening in their state. I know certainly you heard a lot about some of the nuances between states and how they are navigating what we know and certainly what we don't know into the future. And we will be hearing a lot more in the coming weeks. And so you've heard a little bit more about how they are working through some of these opportunities and challenges into the future. I hope this has been helpful in answering some of your questions. If you have additional questions, feel free to drop us a note at our ASTHO press office. We are happy to direct any follow-up questions to our panelists or to others in the ASTHO network and make sure you get information you need to help answer those. So again, thanks so much for joining. We know there's a lot going on. Appreciate you focusing on this topic today. Bye.